Hello, and welcome to NYC Health and Hospitals Kings County YouTube podcast. My name is Maria West, Director of Mental Health and Substance Use Disorder Services. And today I have with me Sasha Ashton, our Addiction Program Administrator. Today we'll be talking about risk factors and prevention. Sasha, welcome.
Thank you. Great to be here.
So some of the major issues around substance use is around where it began. Let's talk about the genetic and biological risk factors. This is what you do daily. Tell us a little bit about some of the things that you work with.
Sure. Chronic substance use can cause severe structural and functional changes in parts of your brain that are associated with cognition, emotion, and memory. There are many psychosocial factors, socioeconomic factors, and genetic factors that can lead to substance use disorder.
So some of those are really basically coming from family members. Talk to us about the connection between substance use and family.
Many people experience socioeconomic issues. They may be influenced by their peers, the age at which they're exposed to substance use disorder. They may also experience employment deficits, sociocultural factors that contribute to the development of substance use disorders, and other risk factors. For instance, if you have a parent who is diagnosed with a substance use disorder, you are more likely to develop a substance use disorder yourself. Other factors like age and gender differences also contribute to substance use disorders. For example, drinking is usually more acceptable for men than women. Because of that, men are more likely to feel pressured or expected to drink in social settings. Men tend to feel intoxicated at slower rates than women, allowing them to consume larger amounts of alcohol. All of these factors contribute to the onset and progression of substance use disorders.
Thank you, Sasha. This is a really comprehensive look at some of the biological factors related to substance use, and it's really important that we understand that it takes a community. It starts with the family, and it's important that everyone is part of the recovery process. Let's talk a little bit about nature-nurture and just how all of those factors impact substance use.
I'll be happy to. Nature versus nurture is a debate that has long been standing in the area of substance use disorders and the role that it plays. Genetics play a very pivotal role in the progression or onset of substance use disorder. Genetics or genes can account for up to 60% of the risk of forming an addiction or substance use. For example, the DRD2 gene can cause the brain to release a large amount of dopamine, which can contribute to addiction. Also, your environment that one is placed in. A positive environment can lead or help people with a genetic predisposition to addiction to avoid destructive substance use disorder habits. However, people without a genetic predisposition to substance use may turn to using substances as a response to an unhealthy environment or relationship. Experiencing trauma or major life changes can increase the likelihood of substance use as a way to cope with the emotional pain. Substance use disorders can also be developed through social learning. You are more likely to develop a disorder if you have a parent or an influential adult in your life that uses substances. The expectations of substances' ability to help you cope with stress are important as well. If you expect substances to relieve stress, or if you use them as your primary coping mechanism, you are more likely to develop a substance use disorder. If you do not have a family or friend support system, you are also more likely to develop a substance use disorder. If you're overwhelmed or experience social problems, you are at a higher risk to possess characteristics such as the tendency to be impulsive, seek thrills or sensations, or exhibit antisocial behaviors.
Those were very important factors about the nature-nurture aspect of substance use disorders. And one of the things I want us to really focus on now is the importance of preventive treatment and early intervention. those are really key in helping someone recover from a substance use disorder. And it's important that everyone understand that a substance use disorder is a medical issue and you can recover. Early intervention really is where we start with getting someone on the road to recovery.
You're absolutely right, Maria. To add to what you've said, substance use disorders can be difficult to overcome, but it is not impossible to get sober or abstinent. If you also suffer from mental illness, it is also important to get help for that as well, because they are very correlated. You can conquer addiction no matter what the biological, psychological, or sociocultural factors that apply to you. You always have the ability to make choices in life. Drug and alcohol treatment gives the tools and strategies that can help protect your biological, psychological, and sociocultural vulnerabilities. Here at King's, we have several options for you to choose from.
Thank you, Sasha, for joining us today for today's podcast. You gave us some really valuable information, and it's really important that early prevention and treatment happens for our patients. Here at Kings County, we can treat the whole person. We are a community health center that can provide treatment for anyone with substance use and or mental health. It's really important that the community knows we can help them. Thank you for joining us for today's podcast, and I'll see you at our next episode.